Thank you everyone for joining us for our December call with Alameda Public Health, Ombudsman Services, and long-term care facilities. We appreciate your participation and are eager to hear today from Dr. Hill, who's going to talk to us about infection prevention and the flu season and how those two things fit together and how we as long-term care providers and advocates can best serve our residents. Just a reminder that this is an interactive session, so if you could please feel free to drop your questions in the chat and Q&A. No question is too small or something we don't want to answer. You can find those there. This recording will also be made available along with the slides in the coming days, so we'll send it to you at the email address you used to register. If you have any follow-up questions afterwards, we'll be happy to answer those. So again, if you have a question come up, feel free to drop it in the chat or the Q&A. And with that, I'm going to turn it over to Dr. Hill. Thank you so much for joining us, Dr. Hill.
Thank you, Nicole. So my job is to talk about influenza and how that dovetails with what we've all been struggling with over the last 6 months. So I'm going to share my screen and let's see, slides. My confession, you may think this a little odd, but my confession is I've always loved influenza because influenza is something you can prepare for ahead of time. It's very, dealing with it in a long-term care facility is very methodical. You need a plan, and then you wait. And then on a Friday evening or Saturday afternoon, you've got your case. And if you've planned everything right, then you execute with testing and prophylaxis and treatment for a couple of weeks. And it's all kind of works like clockwork. So this year, of course, it's a little different. So I'm not as happy with influenza this year because COVID has complicated it significantly. This slide indicates that both flu and COVID have very similar symptoms. I'm showing here in the middle of the slide, fever, cough, runny nose. Basically it's cold symptoms, or the public health people all talk about ILI, influenza-like illness, and both COVID and flu can present as influenza-like illness. Flu, of course, caused by one of the influenza viruses as opposed to SARS-CoV-2. Both are transmitted basically through droplets. It's mostly person to person. There can be some COVID transmission in the air, but basically this is person to person, kind of the usual stuff. The huge difference, I think everybody fully understands now, is that about 40% or so of the COVID cases are asymptomatic. And so COVID can present with really very mild symptoms. Flu, usually a little more classical. So good to know the differences. I encourage people when you get these slides to print this out and share it with your staff. And I don't know how many of you understand or have seen the Swiss cheese model of something bad happen, but it's basically kind of like when the stars align, when the holes in the cheese align, then something bad can sneak through on a straight line. But if you've got a number of Swiss cheese slices and the holes don't line up, then you've stopped that something bad from coming through. So in the case, this slide was made for COVID, but it's going to apply for influenza as well. that, it's physical distancing, it's masking and hand hygiene, don't touch your face, limit your time in the presence of somebody with COVID in this case. Good ventilation is good, outdoors great, and isolate, quarantine when necessary. All of these added together are actually terrific protection. And I keep wanting to remind people that masking, for months now, we've been talking about source control. Please mask, because if you've got COVID, you don't want to give it to your neighbor or your loved one. But in fact, over this last couple of months, we have very, very good evidence that if you mask, it reduces your chances of getting the illness. And if you get it, you're going to get less of the virus coming through, less inoculum, less dosage, and your symptoms, you either won't have symptoms or they'll be milder. So I think please, please, please get out the message that masking protects you against any COVID floating around out there in the world. And this slide changed my life. I'm a doctor. I've always said you have to wash your hands well for 20 seconds, etc. I never got all the pieces I think correctly. This picture is now over our kitchen sink to remind me about the different steps of hand washing, and particularly the motorcycle throttle, because this the back of the thumb is the place where we have evidence that that's the one that keeps the germs because we don't wash it very well, etc. Anyway, you should put this up on all the walls in your buildings. Hopefully most of you have seen the CDSS pen about COVID and planning for it. These were slides developed in October about the pandemic, and I've just stolen one or two, I think, and about please vaccinate. If you've got residents who have not gotten vaccination, you really need to go there. And also, all of us who are in healthcare need to get our vaccination. It's it's part of our duty as healthcare professionals. The note here says education, education for particularly your staff or residents who are resistant to getting flu vaccination. And absolutely, going over and over again, the vaccine doesn't cause influenza, and you know the drill. However, this year, in Alameda County, we've strengthened the directive. Until now, the public health order said, if you refuse to get a vaccination, when you go into the facility as a healthcare worker, you have to mask. Well, we're all masking now. So our health officer has issued an order that basically mandates healthcare workers to have vaccination unless they can produce sufficient documentation to obtain a medical exemption, or unless the person is subject to accommodation for a disability or sincerely held religious belief. This ups the ante for people who want to say no. You have to produce some documentation of that, or else you're not allowed to work. Okay, so the influenza drill is when it starts to hit the nation and the state, then you start watching, and that's surveillance. We're all doing this now with regard to COVID. So it's just yet one more thing to think about. Please, if your staff, you're already doing this, I think, but if your staff say, I'm feeling ill, then you need to think about that and chase it down. The Alameda County Public Health Department has released its own guidance regarding influenza-like illness and outbreaks in long-term care facilities. So these apply to all our RCFEs and adult residential facilities, as well as skilled nursing facilities. This is the first page of the guidance, and it gives the definition of an influenza-like illness, as well as a cluster and an outbreak. What's really important, maybe the most important thing I have to say other than hand washing, is a report as soon as you have a case. Pick up the phone and call the public health department. And everything else I'm gonna say, the staff will guide you through. It's pretty straightforward. And the document is pretty straightforward. I like to use documents like this as just-in-time learning. So I read it ahead of time, and then when I have to read it again, I really pay attention to every word. But the drill is surveillance. In order to be ready for a case, you need standing orders from the primary care physicians or your medical director. Everybody who has got a warm body needs a vaccination, and you have to be prepared for testing, and then the use of medications for treatment and for prophylaxis. But the start is to figure out with the testing, is this influenza or COVID, or, oh my God, could it be both? So diagnostic testing, hopefully you will have multiplex testing available for you, which will test for influenza A and B and SARS. So that would be ideal. Otherwise, it's probably 2 different swabs and test. Figuring out what your options are now, if you haven't already done so, would be a very good idea. Once you have a suspect case, you need to go ahead and kind of launch the program. So prioritizing single bed rooms, obviously moving a person if you can and need to. If you cannot move a person into a single room, a suspect into a single room, 6 feet, privacy curtains, the usual kind of thing you're familiar with COVID. If you've got someone with influenza-like illness, you don't know whether that's COVID or flu. So I would urge you, please treat that person as a person under investigation for COVID. The last thing you want to do is let a day or so go by and have COVID spread throughout your facility and to your staff and yourself. All right, just a couple of more slides that I've picked out to go over from this fairly complete document. It's got a lot of nice appendices and useful educational material. When you're sure you've got influenza only, and you don't need to do COVID transmission-based precautions, so you have not moved this person into a red or a yellow area, then it's droplet precautions, which is gloves, and a face shield, eye protection. Face shields are a great new addition to our armamentarium this year. And the N95 aerosol generating procedures, I don't think you're going to be doing that in an RCFE. Hand hygiene, face mask, face shield when you enter the room, gowns and gloves. Certainly if you're going to be exposed to any secretions, close contact. And then you have to don and then doff. You get rid of your PPE on the way out of the room appropriately. Hand hygiene, hand hygiene, hand hygiene. Please try to get face mask on residents if you've got influenza. This requires, in the case of people with cognitive impairment, a lot of ingenuity on your part. I know that. I'm not gonna, I know you know that. It calls for a lot of creativity. And again, single room, if you can pull it off. The only thing I'll say about treatment and prophylaxis is, again, have to be ready ahead of time. Flu tends to arrive on the weekends. I have scientific evidence for this based on my own experience. And yeah, you need to go ahead and move quickly. You really need to get treatment in the person within 48 hours. And you need to get prophylaxis out there. The antiviral oseltamivir is the usual. You need to get it out to the other residents, either in the room or unit, wherever, or the entire facility as soon as possible, and continuing for a couple of weeks. And let's see, that's my last slide here, the CDSS resources that are listed. And
Dr. Hill, can we just, I had a question pop up in my head as you're going over the last slide around that. Obtain orders for antiviral medication before there's a problem. So can you talk about how skilled nursing facilities can go about having that conversation with their medical directors and what they should be saying and how they can obtain that? And if they are a residential care facility for the elderly, how can they have that conversation with their residents, physicians who are not medical directors, they're not on site?
My inclination would be to just, however you get orders from your PCPs or medical director, you just want an order that's signed by each of the physicians, if you've got PCPs who are writing orders, or often the medical director. I was always comfortable writing orders for everybody in the facility, as well as sometimes in the case of influenza vaccine for staff as well. Again, you need to get on the phone now and make sure that the medical director has a plan for this. It buys into your plan, and that you've got the kind of the pharmacy chain as well, right? So it's one thing to have an order. Are you going to be able to get that medication delivered? Again, because everything happens on the weekend. So I think it's a great question. I don't have a specific answer because so many of you are in different situations. And actually, if anybody on the call has perfect a best practice, we would love to hear from you.
Thank you. And just a reminder for everyone on the webinar today, you can start dropping your questions for Dr. Hill or Alameda Public Health into the chat or Q&A box. I know I certainly have some popping up for myself, and I'm sure there are for others as well. So please go ahead and add those there, and we will get to those. Dr. Hill, did you want to go ahead, or David, are you ready to take on the next portion of the presentation?
Yes, can you hear me?
We can.
Great. Let me go ahead and share my screen here. And can you see my screen?
We can.
Excellent. All right. Hello, everyone. It's David Farrell with the Alameda Public Health Department Long-Term Care Facility Task Force. And at this portion of the webinar, I'd like to review with you the new health officer orders that were released by Dr. Nicholas Moss on Tuesday, November 23rd. A little bit of background, and this might be review for some of you, but there is strong evidence around why we issued these health officer orders that will be impacting many long-term care facilities throughout Alameda County. First and foremost, we know that more than 40% of residents in long-term care facilities are asymptomatic. And in this research study, they studied those facilities that conducted baseline testing of all residents and staff and they identified more cumulative rates of asymptomatic and pre-symptomatic infections than did facilities that tested only symptomatic and exposed residents and staff. So this particular study here, the results here, therefore underscore the importance of universal facility-wide testing of asymptomatic staff and residents to identify and isolate cases. In addition, we know how vulnerable the staff are, to contracting the virus in the communities where they live. And now we have a mountain of research now that supports the necessity of all long-term care facilities to aggressively test their staff. And these particular research studies, each one of them points to the fact that the staff were the unknowing individuals who brought the virus in. And here in Alameda County, when our skilled nursing facilities were only testing 25% of their staff each week, we had a number of outbreaks within our skilled nursing facilities that spread to the residents. Since the skilled nursing facilities started testing 100% of their staff each week, we've seen the majority of those outbreak cases maintained only within a few staff members themselves with no spread to the residents. So clearly, testing the staff and testing the staff frequently is an evidence-based approach to mitigating the COVID outbreaks. And in this study, we also learned that those long-term care facilities in which testing was conducted after a confirmed case were found to have significantly higher proportions of infected residents and staff members at initial response testing and 4 weeks later, whereby those long-term care facilities in which testing was used as a preventative measure, the initial prevalence was significantly lower and fewer cases were identified during follow-up testing. So as a result of all that evidence, on November 23rd, Dr. Moss issued Health Officer Order 20/18 that increased the testing requirements for long-term care facilities. These are primarily facilities that are not skilled nursing facilities, because skilled nursing facilities already have strict testing mandates by CDPH. Our other long-term care facilities within the county didn't have the same strict testing requirements, and as a result, this health officer order was issued in order to fill that gap. So therefore, all long-term care facilities are required to complete baseline testing of all their residents and staff by December 26, 2020. After baseline testing is complete, all long-term care facilities in Alameda County that are 6 beds or less are required to conduct screening testing of 25% of their staff each week. And after baseline testing is complete, long-term care facilities that are 7 beds or more are required to conduct screening testing of 50% of their staff each week. Health Officer Order 2019 was also issued on November 23rd. And this particular health officer order issues a standing order for coronavirus testing of long-term care residents and staff. And what this does is it eliminates the time-consuming process of long-term care facility staff to have to call all the residents' primary care physicians to get an order for testing. Under this standing order, that is no longer necessary. And as a result, this standing order increases the timeliness of response testing and increases access to COVID testing for residents and staff. And then finally, also on November 23rd, Health Officer Order 2020 was released. And this particular health officer order imposes additional visitation restrictions on long-term care facilities in Alameda County when they're in the midst of response testing or when they're in the midst of an outbreak. So therefore, for the long-term care facility leaders on the line, please be mindful that you should suspend all indoor, in-room, and indoor communal space visitation when you're experiencing a COVID-19 outbreak and conducting response testing. You should always maintain safe outdoor visitation and follow the specific exceptions by CDPH for indoor visitation. And of course, you can resume indoor, in-room, and communal space visitation when 2 rounds of response testing are completed and they do not reveal any new positive cases. There are certain long-term care facilities in Alameda County that don't need to complete baseline testing, and those would be the facilities that have already experienced an outbreak and already conducted response-driven testing, or long-term care facilities that have already completed baseline testing on their own accord of all their residents and staff. And we expect that these long-term care facilities will already have a lab contract in place, already have some experience and competency around testing, and therefore, if they should have another outbreak, they would be able to test everyone in a timely manner. We're offering support to help long-term care facilities, in particular small RCFEs and assisted living facilities, to meet these additional testing requirements. We have some resources available to deploy to assist small long-term care facilities in meeting these new baseline testing requirements. In addition, staff can be tested at any of the Alameda County Public Health Department community testing sites, and you could find the information and schedule on our website. The Alameda County Public Health Department and Nicole and the Ombudsman Services are distributing hundreds of pulse oximeters to RCFEs around Alameda County. We've also organized a flu vaccination strike team that will be deployed to some small RCFEs. And in addition, we have a list of vetted, contracted lab providers. And if you need any help accessing a list of approved lab providers, you can let us know. Remember, for all long-term care facilities, we're all required to follow the strictest requirements. And if there are differing requirements between your regulatory body, the state, the feds, or the county, then you should follow the strictest requirements. And that concludes my update about the health officer orders that were issued on November 23rd. Nicole, would you like to?
Absolutely. Thank you, David.
Yep.
I wanted to talk about something that David mentioned, which is that you will begin to receive, Christmas is going to come a little early, and Santa is going to drop gifts on your doorstep if you are a residential care facility for the elderly. So over the next 2 weeks, you will begin to see brown paper bags being delivered to your doorstep with pulse oximeters and instructions for their use from Alameda County Public Health. So as you know, a pulse oximeter is a device that attaches to your finger, and it essentially estimates or gives you a good idea of the pulse saturation level. As you know, for individuals who experience dementia, they may not be able to tell you if they're experiencing distress. And this is an easy way, or potentially an early sign, if you do need to seek medical assistance for them. So beginning later this week, but likely early next week, you will begin to receive these on your doorstep. For the smaller facilities, you'll get 2, and for the larger facilities, you'll get up to 8, so that you can train your staff and they can be readily available. There are instructions for not only what the device is, but how to use inside the bags. And we really hope that you will use these in your toolkit to combat the disease and prevent the spread. So if you have any questions, you can reach out to our office. But again, you should prepare your staff that you'll begin to see those early next week. And if you have any questions, you can reach out to our office. So David, we have some questions popping up in the chat. So I think you have another slide with contact information. Is that true? If not, we can go right to questions. Yeah.
Yes,
So,
we can go right to questions. I just had one more slide as it relates to fit testing, and I was hoping to get some feedback from the group, and you can type this into the chat box. We're asking just what barriers are you facing related to completing fit testing for your staff? And if you have completed fit testing, please share how it was accomplished. And with that, we'll open it up to a Q&A. Anything for Dr. Hill or Alameda County?
Excellent. So one of our providers asks, what do they do when they're having residents who are refusing to be tested? So I think that's both a question around like how to handle that, but also how should they document that for their records?
Yeah. If you're in the midst of an outbreak and a resident or staff member refuses, they essentially become a person under investigation, or a yellow status, if you will. And they would have to isolate or quarantine, I guess you'd call it, for 14 days. So if the staff member refused, they have to quarantine for 14 days until the outbreak is cleared. And for the resident, they would have to be of a yellow status, and the staff would have to wear full PPE when caring for them. If you're in baseline testing, well, that's a little bit different. You're not in an outbreak, but the resident is refusing. You wouldn't essentially have to put them as a yellow status if you were doing baseline testing. However, you would certainly want to be mindful of the impact of that refusal should you have an outbreak and have to do response testing. And it would be good to share with the family or guardian or resident how they would have to quarantine as opposed to simply getting a test.
So if a resident were to refuse to be tested and the facility documents that, and they've of course met with them and explained the risks, explained why they're doing that, do they need to notify the local public health officials?
No.
Okay.
Just have a policy like I explained on how to deal with it.
And then do you think you could also explain fit testing a little bit, sort of what it is and what is the process to get your staff fit tested?
I could, but I have an expert on the line in Renee, and I'm wondering if Renee, you could unmute yourself and share with the group. I wasn't able to produce that slide at the last minute.
Yes, sure thing, David. So fit testing is the process that you have to complete if your staff are wearing N95 respirators. For each make and model and manufacturer of a respirator, the individual who's wearing that needs to have a test that is done. We are doing the qualitative fit tests here to ensure that the mask fits them properly and is actually protecting the wearer the way that they should in order to properly filter the air that they're breathing in when they're wearing the respirator. So with fit testing, we are really encouraging that facilities have a plan to fit test their staff who should be wearing an N95 mask. And you should be doing this ideally before an outbreak occurs, because once the outbreak occurs, the staff that should be protecting themselves and wearing a mask will really need to know that the mask that they're wearing is actually protecting them when they are possibly exposing themselves to a respiratory illness. And so with what we're doing with fit testing is that we are offering classes for facilities to be able to attend so that they can have an employee learn how to perform the fit testing. But what we are interested in is really knowing, which facilities are still having barriers with completing fit testing. Some facilities have been able to attend a training, and we want to hear how the fit testing has been going for your facility. Things like changing N95 suppliers, because every time, if you order a different brand of an N95 mask, you have to fit test the employee who's wearing that new brand. So if you're wearing, a 3M 8000, and then you get the BYD, you have to fit test everyone again, because the fit test is only valid to tell you that the mask that you are fit testing fits that individual. So yeah.
And Renee,
that's
don't
the
we have
basic gist.
don't we have a training scheduled on December 11th you could tell them about?
Yes, so we do have a training scheduled. This is a training for people to learn how to perform fit testing. So this means that once you attend the training, you will be able to fit test other people. This does require you to have a fit testing kit, but we can go over those details at the training. But the purpose of this class is for interested facilities to be able to send an employee to come and receive a training so that they know how to be the person doing the fit test. And when they go back to their facility, they can perform the fit testing procedure on other staff members. And that will be next week on Friday, December 11th. And if you want more information, I will post my email in the chat box for you to reach out to me.
Renee, in addition to posting your email in the chat box, we've got some folks on the phone. Would you mind saying your email as well? And just a reminder, everyone, we will be emailing the recording of this and the slides out after the session today. But Renee, so can you drop it in the chat, and would you mind now just saying it as well for those on the phone?
Sure. My email is Renee, RENEE .yun, YUN, at acgov.org.
Thank you. And I also just want to highlight, Renee used terms interchangeably of mask and respirator. And I know that might be a little like, I don't get the difference. An N95 is called a respirator, but we sometimes call it a mask too. So don't be scared by it. It's not a big suit like Contagion. It's a mask that filters out a 95% of the particulates. And it's going to have a very firm seal around your nose and your mouth. And it's important that you realize that's different than a mask you get at, say, Home Depot, right? An N95 mask is not an N95 mask unless it's been fit tested. And I really want to reiterate that for those of you who are having maybe challenges setting up fit testing, is that resource that the county is providing is an incredible opportunity for you to get fit tested or to become a trainer, so then you can get the kit and then provide that for your staff. I also want to highlight what she said, which is it's a little bit like buying clothes. Like a medium is not the same medium as Old Navy as it is at Macy's. So for example, I am fit tested on a BYD mask, right? And that's the mask that fits for me. But I have staff who are fit tested on a 3M mask and they can't wear the BYD masks. So please be mindful that if you're fit testing staff, you should record what mask they have been fit tested on so that you have a ready understanding of what you need. Now, to the county, we have some questions here saying, it's getting challenging to get and procure N95 masks. So if a provider's having problems getting N95s or other PPEs, who should they reach out to get assistance?
They can reach out through the MOOC and request supplies through the MOOC. And if anyone needs information on how to make that request through the MOOC, we will provide that to you in the chat box as well. Or we'll add a slide to the deck so that you have it when we send it out as well.
And then there's a question of how should they deal with visitors in N95 masks? Is that something they should be requiring of folks who want to visit family members? Or is it enough just to require normal cloth or dust mask?
Well, right now we're in the purple tier. And while we're in the purple tier, facilities don't have to, or shouldn't, I should say, accommodate indoor, in-room, or communal space visitation. You certainly can accommodate the acceptance, and you can accommodate outdoor visitation, which is the safest mode at this time. So certainly within this tier, well, we're in the purple would be the only tier where you can universally close down to indoor visitation.
Thank you, David. You said something important, which you started to touch on, which is sort of how do you deal in special circumstances? And we have a question here about how do you work with residents who are on hospice, who are bedridden, who maybe are at the end of their life? How can facilities work with family members to ensure that there is some connection with the outside world as they are preparing to pass? But also, how do we accommodate residents right in that of if a resident is refusing to wear a mask, how can the staff around them make sure that they are still safe?
Mm-hmm. Well, related to visitation, certainly, if end-of-life visitation should be accommodated. Certainly, we have the option of virtual if that works. In those cases, we would want the visitor to be tested. We'd have to make sure they don all the PPE appropriately if the hospice resident was in the yellow or the red area, so that they could safely visit with the person in their room. And of course, we would want to be fitting the visitor with an N95 mask, and therefore it would be critical to have someone on staff who could do that for the visitor in real time so that they're safe as well. And what was the second part of your question, Nicole?
More like, how do staff respond if a resident is either unable or unwilling to wear a mask? I'm thinking particularly those who have memory care issues. How should the staff respond to ensure that they are maintaining safety protocols as much as possible without forcing the resident?
Certainly. CDPH for a few weeks now has been discussing, the root causes of large outbreaks, and they've frequently cited, memory care facilities and RCFEs that specialize in caring for those living with Alzheimer's or other dementias as settings that tend to have breaks due to residents choosing not to wear the masks or choosing not to wear them correctly. As a result, CDPH has released on their website a number of offering tips and best practices related to trying to get residents to wear their masks and stay 6 feet apart. And certainly I have those here on my computer as well for anyone who'd like to see them. But please, you could go to the CDPH website or just simply Google best practices for memory care facilities, CDPH, and I'm sure it would pop up for you. And that gives you some good tips related to trying to get compliance or encourage compliance amongst residents living with Alzheimer's or other dementias.
We have a question that's come up that I think everyone has been dealing with for the last 7 months, which is, how do you isolate a resident that is refusing to stay in their room, maybe due to behavioral issues or dementia? And so I'm guessing a couple folks might have theories on that, but I wanted to offer activities is the key. Residents wander or move out of their room when they are like the rest of us. They are bored and they can't exactly Netflix and chill. So I want to encourage facilities that if you're having this issue, you should look to what activities you're making available to the resident in the room and how frequently are you having staff check in on them. So if you give someone an activity and you walk away for 30 minutes, that might be beyond their threshold. So maybe start the activity with them. Maybe a CNA leaves and comes back in 10 minutes and builds that tolerance. But don't simply think that you can, sort of put a resident in a room and that they are going to happily stay there. So I really would offer that it's key to look at the activities you have available in the room and the variety of activities you have available in the room, and wanted to open it up to the rest of the team on the call to see if they have thoughts.
Yeah, I think those are good suggestions, Nicole. In addition, I think most people know that in the state of emergency, you can utilize staff in very creative ways. If you have staff on light duty, do a workers' comp injury, you can have them doing indoor visits. If you have a housekeeper on their day off, you can utilize them to do in-room visits and activities for certain residents who have a lot of energy. So you really your scope of who utilized to serve the residents is much wider than it's ever been in your entire career. And you should really be very creative if you can in employing all sorts of folks that could be helpful in engaging your residents at this time.
There's another
Any
question
other?
about fit testing, and the question is, how long is the Train the Trainer class?
The Train the Trainer class is 2 hours, and we will be holding 2 separate sessions on that Friday next week. So again, if you email me, I will contact you to tell you more details. And we really do want to emphasize that this whole process of fit testing, we understand, can be a burden, and it is a lot of work and takes time and is a lot of documentation. But really, it is for the safety of you and your fellow staff members and also your residents. So we are really encouraging that if you are able to plan for this and do it early, because it will make your staff feel like they have some level of protection, that they know that their mask fits them, that it is filtering the air the way that it should. And it really just is a best practice that if you can do it, reach out to me and we will figure out the details together. I am here for your support for the fit testing. And so just definitely reach out if you have questions.
Thank you. And lastly, there was a follow-up to our last question, which was sort of asking is like, what if a resident won't participate in activities? And the question I always ask is, what are you doing to allow that resident to have some outside time? We have seen facilities be most effective when they had, even, when they can't have visitors, just take the resident out in the back area, in a courtyard, take a short walk, that urge to leave a building is a natural one. And if you do your best to stay on top of that, that can help at least mitigate, if not eliminate, some of the other issues. And so with that, we don't have any other questions. So I wanted to open up to the panel. Are there any other information our facility should be aware of today?
Well, I think just like you said, Nicole, all behavior is communication. And so if the resident is behaving, they're trying to communicate to us, and it's our job to figure it out and to listen and to react. So just like you said, if they're indicating through behavior they really want to take a walk, then we got to figure out how to get them on a walk, right? So those were good suggestions. Thank you, Nicole. Terry, anything from you to wrap it up?
You're on mute, Terry.
Just to thank everybody on the call for doing this work. I like to point out at this point in the COVID game that we have learned so much in the last 6 months, entire new languages. We've put in place new practices. I think you all deserve a pat on the back for, this has been an incredibly steep learning curve. So thanks for not falling off, and let's keep at it. There's, spring will come and things are going to be looking much better with the vaccines and the treatments and everything that we've learned. We can get through this.
Yes, indeed. These will be hard weeks, but the real heroes on this call are all of you. And I know you keep pointing at your staff as the heroes, and they're the heroes too, but really the leaders of our long-term care facility, you're the heroes. So thanks so much for all you're doing.
We just want to thank everyone for joining us today. I remind you that we'll be releasing the recording and the slides shortly, so you'll be able to share with your staff. If you have any follow-up questions, you can reach out to the email provided on your screen or any of the other providers that you're aware of. If you have questions about fit testing, I encourage you to reach out to Renee. Let's fill those classes next week. Thank you very much, everyone, and we look forward to seeing everyone shortly. Bye-bye.
Thank you, Nicole. Bye-bye.